People, if you're watching this, I just had everything all set to go, and suddenly I have a minor error. So let's hope. Having a reader error. I don't know what's going on there. Let's try this. Okay, everyone, welcome to Miller Time this evening. And I'm going to, before I get too far into this, I'm just going to ask, can you see me? Can you see me? I love this technology, and I think I have it all set up, and then every once in a while it does something that I don't expect, and it goes right when I'm live. So there's 5 people listening. Now, someone just please comment if you can. Let me know if you can see and hear me, and we'll keep going, assuming that everything is okay. But I am running into a bit of a technology issue. So let me bring it up on my phone. Let's see how this goes. Yep, we're going. Okay. I think we're okay. So I'm just going to go like we're going okay. So can someone please let me know if there's any issues involved with watching me? So I'll start it off a little bit rough, but I'll get started now. Welcome to Miller Time. I'm State Representative Tim Miller in Minnesota, and this is where I weekly come on Monday nights to give you updates on things that are important to my district and to the state of Minnesota in the Minnesota legislature. Well, right now we kind of have one major subject on hand in our state, and that's what we're going to be spending the entire show on here today. So I encourage people to ask me questions in the comments section. Let me know what you're thinking or whatever questions you have, and I'll certainly answer those. So as always, I ask that you subscribe to this channel so you can get reminders of when this show's on, so you can join me each week. Let your friends know. Communicate out if you like what you're seeing here. If there's subjects you want to talk about, we're going to be on this probably for the next couple weeks, but we'll try and bring in some other issues or some side issues to this. But certainly as time goes on, we don't want to be talking about the COVID-19 outbreak the entire time for the next couple months. So there'll be other issues that we can bring up. So certainly let me know if you would like to. Unable to connect to chat. Like I said, we're having some issues here. Let me see if I bring it up on my phone. Okay. Okay, I see that it's going. I need to okay. Well, we are not having a good time here. I apologize for this, folks. Let's try it this way. Okay, we do. Yes, people can hear me, and I had to move over to my phone. The chat's not working properly on my computer. I'm going to have to figure out, I get things all tested out before the show starts, but when we go live, what YouTube decides to do with that isn't always real consistent. So I do have my phone. I'm not going to look down at it too much, but if you have any questions or comments, put it on there. So we're going to get going now, and if you've seen my show before, I tend to keep things tight to schedule. I want to talk about the issues. I don't want to blather on and on about my own thoughts or opinions on things. I just want to deliver what's happening in the state of Minnesota to you as well as I can communicate it. But this week, because of all the events of the last week and a half, I do want to add a little bit of comment here, maybe just a little bit of monologue to what's been going on with the COVID-19 pandemic, the outbreak, and some of the things that I've noticed. I've talked to many people. All right, we have a new subscriber. Thanks, Afton. I've talked to a lot of people in this district over the last week, in particular, small business owners, people, elderly, people that are home, people that have questions. And I'm always open for that, and I want to make sure that I'm always accessible. So please contact me anytime. You can reach me at my email address. I'm going to type it, and then we'll see if it goes in there, because like I said, this thing doesn't seem to want to work the right way. Well, we're just going to have to deal with that later. So anyway, but my email address is rep, R-E-P, tim.miller@house.mn. And if I can figure out how to type that in here, even though my chat room isn't working properly, I will. Let's try this. Okay. Oh, there we go. It's working. So I'm going to type in my email address. And a lot of people think I'm crazy for doing this. But until someone misuses it, I'm going to keep doing it. I'm going to give you my... There's my email address. And I'm going to give you my cell phone. And I want you to communicate with me anytime. Like I said, until my cell phone gets abused, I'm going to continue to do this. I've done it for years and no one's ever abused it. But anyway, there. Now we're kind of back on maybe with chats because I can see the things that you're saying also. Thanks, Eric. Test. We must be doing okay. If at any time we have if we have audio problems or anything else, just let me know. I'm kind of I only have one screen instead of two like I normally have, and so I'm kind of juggling a lot of things here. We'll do our best to make it work though, right? So anyway, before I begin with some of the details, what's going on, and I see that there was a good question there. Where'd it go? Let's see. I'm not seeing a question there now. So anyway, sorry. We're doing great with this show, aren't we? Well, you get what you pay for, I suppose. So, but I want to very seriously, though, something that's been on my heart after talking to all the people in my district, and we're doing a lot of different things that I'm going to share with you, and I've seen great things in people over this last week, and I expect much more of that to come. Okay, there's the question that came back up. I'll answer that in a second, Jamie. So, but really, Abraham Lincoln had a phrase at the end of the Civil War that I think is appropriate. When the war had ended and there was a lot of people that wanted to get back at the South, a lot of people weren't sure about the federal government. There was all sorts of issues to deal with. And what President Abraham Lincoln said is we need to address things with the better angels of our nature. And I thought that was a great, great way to explain things, because I think that's what we need to do is some of the things that I think we should be is we should be patient with each other. I think we need to be kind with each other. But while I want you to be safe, do the things that they recommend, keep distance. If you don't need to go somewhere, don't go, but we don't want you to stop living your life. So just keep your distance, wash your hands often. If you aren't feeling good, certainly stay at home. But I don't want you to be afraid. This is not something that we need to fear. This is a sickness, and we're going to have some big challenges ahead of us. Hopefully the challenges are smaller than could be the case. But in any case, don't fear. I think for the most part, people are going to be okay, and I think where most of the fear is coming from is the unknown and what's to come. A lot of this is playing out now, and we're going to see it. I'm going to address some of the things that the state is doing right now here in a little bit, and I'm also going to address what might happen, and I think that's where some of the fears are being generated, but don't fear. Be respectful of others' feelings and their reaction to things. I've talked to a lot of people, and there's some people that believe that we are making a big deal out of nothing here, and there's other people that are saying this is really, really, really bad, and we just need to batten down the hatches and just try and survive through this. I will tell you that the truth lies somewhere in between there, or at one or the other ends. But what I've really come to understand is that this is really drawing out who people are, where their securities are, what their feelings are on different issues, and there's a lot of people that are nervous and tensions are high. So if someone kind of flares up at you a little bit, show them a little bit of grace on that. Also understand, it might surprise you. I know a lot of people, and I'm usually a good read on character and how people will react to things, and I can tell you some people that I thought would say this is no big deal are saying this is a huge deal. And people that I thought would say it's a huge deal are like, we're gonna get through this, it'll be okay. There's a lot of questions about the economy, of course, and there are some people that say the economy has to be included in the conversation, and I will tell you there are some people that get really upset if you bring that up that way. So be kind to each other, Be patient, be safe, don't be afraid, think of others. And I really ask that if you're a person of faith like I am, please pray, not only for those that are sick, but the people that are on the front line as well. My wife is a nurse, and she's working a lot with this right now. I know other friends that are nurses, doctors, other MEC practitioners, EMS. There's people that are on the front lines that are doing work. A good friend of mine, Cal, is a truck driver, and he's delivering supplies literally all over the nation right now. And he's putting himself out there for all of us, so please pray for all of those people. So what I'd like to do now is I see some questions and maybe some comments. I'm going to address those. And then when I get into this, I kind of want to tell you what's been going on at the state right now, you can know what has been done or hasn't been done with executive orders. Governor Walz has been given certain special peacetime emergency powers that he's been enacting different things, and we'll touch on some of those. I'll touch on the executive orders. Are they up there? I don't know if they are. I put in some information at the top. I did. If you look towards the top of the chat, I have for unemployment questions, you have a website address. Business questions, if you're a small business owner, there's a real good toolkit with the Minnesota Chamber of Commerce. We'll touch on that a little bit. We're going to talk about the potential stay-at-home order, what that means, what it doesn't mean, what it looks like. And then I want to share with you an initiative that's happening out in Appleton. Some of you may have heard about that. Some of you may have not, and I kind of want to tell you about that because I think it's a good thing, and there's a real good story for me that has come out of that. And so I'll probably wrap this up. People that have been watching before know that I try to keep this to about a half an hour. I'm not going to be quite as stringent on this because I want to make sure that we kind of talk about the things that you want to know, and I certainly want to give time for answering questions. If there's one regret I have, it's that I've been telling people for quite a long time now that I was going to do more and more fancy things as we went along, bring up images on the computer, do some fancy things that make it a little more interesting for you. This is a makeshift here like a lot of other things right now, and I'm just simply not equipped to do that. So like it or not, you get me, and you have the ability to chat back, and that's about the best that we can do in this right now. So I kind of glanced over at my phone. I still see me on there, and my mouth is moving, and I don't see anyone saying, I can't hear you, so we'll just move forward as planned. So I'm going to go to Jamie first, and I'm going to read it, and then I'll answer as briefly as I can, but make sure that I properly answer Jamie. So it says, please explain why decisions are being made to cancel events so quickly without giving the virus a chance to thin out the initial contracting. That's a great question, Jamie. That's one of the things that people really want to know. And here's what I can tell you. In Minnesota, I hate when I do this. I don't have the updated list of numbers, but I think as of yesterday, we were about 114 people that were officially contracted with it. And we had our first death in Minnesota. I believe it was yesterday. So that's not a real big number in a state that has almost 6 million people, of course. But here's the concern that we have. We are not, the only people that are being tested for the virus are healthcare workers and people that are at highest risk. And that's basically people over 70 years old or people that have a deficient immune system. Typically, cancer patients that are on something. There are some other examples with that. We think that there are more cases out there. There was a couple more that were reported out here, one in Lacaparle County, one in, I think, Big Stone County. I don't have the exact places yet, but that's where I think it is. And those are just the ones that are being tested. So there's a real strong belief that if you look at how this disease has gone, there's a wide window of chances of who can be infected and who, or how bad this might be or how bad it might not be. But we have to have precaution. One of the themes that you are going to hear from me, everything that I say, when I talk about what the state's doing, what we're going to be doing out in Appleton, or what they are doing out in Appleton, is we are going to plan for the worst. We're going to hope for the best. So much of what you're talking about is planning for something. Now, when it came to Closing restaurants and bars, I think that was the first time that we really crossed a significant line, because we were saying to businesses, you can't open. And the stay-at-home declaration, we'll get to in a little bit, would do even more of that. That was a significant move, because now we have people that are getting laid off. We have businesses that are at risk. And if you will, if you were to put it between getting sick or having a business open, that's where really the first significant time that we did that. We shut down the schools before that, so that had a little bit to do with that. The legislature recessed for about a month. We worked through last Monday night late in the morning. We'll go back when we have more legislation to pass related to this. We might be there next Thursday. Stay tuned. This Thursday. You can stay tuned on my Facebook. We're not sure. We'll only go into session if we're able to work out some bills that we can provide. You're going to see mostly funding or some rule changes within the departments to equip them to do the work they need to do. So the reason why, Jamie, to kind of sum it up, the reason why they're closing some things, it's to stop the flow. And the big phrase that they've been using now is flatten the curve. Meaning that if this spikes, another way that we've said it is we don't want what happened in Italy. We want to have happen as close as possible what happened in South Korea. South Korea, they really managed this disease well, and they're doing much better than a lot of other people. So Yeetmeister, it says, how serious should I take this when old folks who tell me this is serious? Well, I think I kind of answered that, Eatmeister. I think we need to be sober about this. We need to be prudent, but we shouldn't be fearful for this. So Margaret says, when did we stop using common sense about staying away from others when we are sick? People are relearning things that people used to just know. That's pretty interesting. And I want to be careful to use my example, because some people get a little bit worked up when I talk about influenza, but I'm going to use that as my example. There's lots of people each year that contract influenza. We know that. Influenza kills on average in the U.S. about 70,000 people a year. It's a significant number, and it can be a very deadly disease. Now, a lot more people contract it. Where the comparison breaks up is the coronavirus, the COVID-19, it has a much higher mortality rate. So less people may be getting it up front, maybe same numbers, but you get into one of those risk categories and it's a very higher risk of death. So that's something that would be a difference. But to use the influenza, what have we said for years? How do you keep from getting sick from other people? You wash your hands a lot. You cover your face when you're coughing. If you don't feel well, you just stay home. You use basic care and consideration for other people. That's a large part of what we need to do with this as well. And as Margaret said, I think that we're witnessing that. Margaret, thank you. 235 today. Understand that was up from 141, and also understand that's confirmed cases. So we know that there's more than out there. Margaret said the death was on Saturday. I'm going to get, Eatmeister, I'm going to get to the lockdown in a little bit. I'm going to answer on Jenny Sidney 1, and it says, let me start that over again. What are we going to do to help the restaurant owners aside from loans they have to pay back? Great question, Jenny Sidney 1. The answer is today, I don't have a clear answer on that other than, as I said, go to that Minnesota Chamber of Commerce toolkit, and that's going to give you, there are the SBA loans. The federal government is trying to work through that along with funding other things. I don't know how that's going to work. I can tell you that when the government decided to cross that line and say, businesses, you're going to close and you're affecting that person's business, we as a society, if we believe that that was enough priority to do something that radical of a step, then we need to step forward and help you however we can. I'll do what I can to help you with that. I can't make promises now. There's too much to do, but that certainly will be a priority of mine. Another thing which doesn't really do a lot, but it does something, and I encourage other people to do this. If you have watched, if you go to my Facebook page, and I encourage everyone to do that and like the page or follow the page. I've been going around to different restaurants in my district. I've been to, I think, 4 now. I intend to go to more. and I've been doing pickup. So you do have an opportunity to go to restaurants, and folks, this is a way that we can support those local people who have supported our communities for so long. Understand these small independent-owned businesses, they're the people that are on our school boards, on our city councils. They're typically the EMS or fire. They're the ones that coach Little League. These are the people that are really the backbone of our communities. And at no fault of their own, they're in a difficult situation right now. So find a time to call in advance, order some food. I was at Duffy's in Montevideo last night, and we ordered way too many chicken wings. They're fantastic. We have some leftovers, but you can do that, and it's perfectly safe to go out and do that. You want to keep all the other considerations in mind, that your hands are washed. You don't get too close to anyone, and if you're not feeling good, don't be the one that goes to the restaurant, but certainly do that. So, how many have recovered since contracting the virus? Wait, let me say that again. Jamie says, how many have recovered since contracting the virus? Is the rate normal? So there's a life cycle on this, and I wish I could answer how long it is. I think it's about 2 weeks. I don't know if that's an average or if that's just what it is. It's about 2 weeks. And so anyone that's contracted it, there's an overlapping of time where they stay at home. And a large percentage of people, especially if you're not in one of the risk areas, you're basically going to be fine with this. You'll have flu-like symptoms. I don't think they're real strong flu-like symptoms from what I've been reading, but you will be quarantined. Mostly self-quarantine. You just stay home. You stay in your own room for a couple weeks, and then you do a lot of sanitizing after that in that room. So that is basically, so how many of these people have contracted? Whenever these numbers are starting to report, just kind of take them off as they go through 2 weeks. The number of 235 today, I can tell you that even at the beginning of last week, that number was, I think it was under 30. And so we don't have anyone off of that 235 today that would be considered off of that list at that time. And as Yeetmeister has said in the chat line, the contagion is on surfaces for quite a while. So just be careful. So I want to go into, I've kind of caught up with the comments, and I'm going to go into some of the things that I wanted to talk about. The first one is I think it's good for all of you to know kind of what has been happening from the state to this point. What has the state been doing? And I'm not going to give you a comprehensive, exhaustive list. I'm going to kind of bullet point this. There is a place, if you go to our website, it is, let me flip my page here. Thought I had it on the right page, and I had it on the wrong page. If you go to, here, I'll type it in here. Excuse me, I got to move my notes. I'm trying to use my notes just to glance down so that I don't have. Okay, if you go to this address, click on the menu and go to COVID-19 resources. Hope this makes sense. Let me look. Newhouse GOP, click on the menu and go to, yeah, I'll do it that way. That should work. So if you go to our website and you click on the Newhouse GOP, or you go to newhousegop.com, click on the menu on the left side, that you'll see it, and then you go to COVID-19 resources. That will give you a list of every single executive order that was published. That'll give you a lot of these resources that I've been talking about. It's kind of anything you wanted to know, and probably then some about this in the state of Minnesota you can get on there. So I gotta flip my page back, sorry. Live TV, folks, right? So here's what I want to give you is basically the rundown of what's happening from the state at this time. And remember, the theme is we are planning for the worst, hoping for the best, and it's going to land somewhere in between. My own personal feeling is in rural Minnesota, it shouldn't be as bad as in urban, but that's not necessarily for sure. There's going to be hot spots that flare for different reasons, and we're going to have to learn as we go. I can tell you the Minnesota Department of Health has been doing a great job with this. we probably have the best Department of Health in the entire United States. And I mean that, not just because I live here, but we have that. And they're bringing in a lot of data to determine where they need to focus resources and what have you. They're doing a great job. So what we did was from the state, the governor is empowered. I'll get to his executive orders here in a little bit, his peacetime emergencies. I'll get to that shortly. But we also put some money into different pots. It's been a total of about $245 million so far. That 245 has been really pretty much entirely related to addressing the sickness itself, the hospitals, the clinics. I'll break it out a little bit. We are going to be going back. We're told the governor is going to be asking for another 200 million more. I haven't seen that yet, but that's about the number. And then there's going to be more money on top of that proposed for unemployment insurance, some small business relief that someone asked about early, that sort of stuff. That's not specific. That's what we're going to be talking about if we have session this Thursday. We will eventually address that. We just don't know if we'll have it all done in time to go, because we're only going to go in session if we have something to work on. So stay tuned for that. But the breakout of the 245 million. So when this first kind of started coming over the weekend before last, 2 weekends ago, wow, it's just amazing. This has only been a week and a half. But the Senate put together a budget proposal that essentially gave the Department of Health what they're asking for, and it was about just short of $21 million that we put into their emergency fund. And that emergency fund was primarily for the increased operations for the Department of Health, and also some money that had to go out to some specific health services right away. Right on the heels of that, on the following, we did that on Monday. On that Thursday, and folks, like I said, I'm losing track in a hurry, but it was on that Thursday, we passed another $30 million. $30 million that went into the general state emergency fund. That's a fund that's been ongoing. We tend to put money in there, and then if there's a state crisis like a flood or major tornado damage, or with the avian influenza a couple of years ago, it was used for that when there's a high-path avian influenza killing turkeys and chickens. We used some of it for that. Last year when there was roofs collapsing with all the snow and the melt in the spring, that's what that's typically used for. But it's a general fund at the disposal of the governor to push into different parts of the state where it's needed. So that fund was down, so we put $30 million more in. Now understand that fund and pretty much all the money I'm talking about is only used if needed. If it's not needed, it goes back into the general fund. Also, the federal government is promising to basically reimburse the state for many of these funds. So how these funds shift and what they look like will change a little bit over time. But in any case, this is kind of how it's broken down. So after that $30 million, then on the last Monday, so today's Monday, last Monday was the last day that we were in session. We went until about 3:30 in the morning, getting everything right, came to an agreement with the House, the Senate, and the governor. And there's a lot of hard work there because there's a lot of different thoughts, interests, not on whether we do it or not, but there's lots of little things to that I probably won't get into tonight. We talked more about that last week. You can watch my video from last week if you want to hear about some of the things we put into that bill. It's kind of guardrails to make sure that the money's used appropriately. We put a fund of $50 million in right away. And what that basically gives access to is hospitals and clinics that have the work that they need to do now and the supplies they need. That money is going to be very readily available. There was a simple application that was published. I think it was out yesterday, but it was really published today, and the deadline is Wednesday. And there's going to be applications from all over the state saying we need this money right now, and we're going to push it out right away. Then after that, we passed another part of the bill that was $145 million more that fundamentally really go to some of the similar things. Are there masks needed? Do we need whatever supplies? There's going to be a lot of extra labor in the medical professions with this. Lots more doctors, nurses, technicians, everything. Funding that. Some of those different things that we expect that are going to come on. That's what that money is going to be used for. It's a lot of money, $145 million. But what they're going to do is they're going to assess, if you will, not only what the first $50 million did, where it went, but also they're going to have a lot more information on what's going on in the state. And so once they have that information, they're going to distribute that $145 $1 million as it's needed to those different places. And again, we're putting money in there. We're planning for the worst, but we're hoping for the best. That money is only going to be used if we have the doctors, nurses, and everyone, the use of respirators, all that sort of stuff, if we have to do that. One other little thing that I will add, we'll save that for later. We'll save when I talk about Appleton. I want to talk about what they're doing in the cities. So anyway, that's kind of the funding. And what I want to move on to next is the executive orders. How are we doing with time? We're not too bad. Trust me, folks, I don't have a ton more to go through here. But I want to be methodical to make sure that you understand what's going on. So aside from all the money that we're pouring into this, probably the biggest area of interest and concern, depending on how you're taking it, are the executive orders. So let me first explain what the executive orders are. We have in law, in statute, the governor can exercise a peacetime emergency, and it empowers him to do certain things. It empowers him to basically move more quickly without necessarily legislative action. It's not major things. He can't change fundamental laws. He can't. What he's able to do is do things within his agencies quickly and efficiently that there's sometimes otherwise he'd have to go through certain channels or routes that he just doesn't have to do right now. And again, if you want to know all these executive orders, are pretty plain read. Go to our website, newhousegop.com. Click on the menu and click on COVID-19 information, and you'll be able to get everything with that. So what I want to do is just touch on that, what the executive orders were. His peacetime executive, let me try this one more time, sorry. His peacetime emergency orders empowers him for 5 days, meaning he can do those things and he doesn't have to go to the legislature for those 5 days. And you may say, well, wait a second. Those 5 days are up because he did it on Friday the 13th, I believe, right? So how does that make sense? Well, there's also in the Constitution that there's an executive team that is basically the constitutional officers. So Secretary of State, Attorney General, and the auditor, and they can approve for him an additional 30 days. So it's basically 5 plus 30 or 35 days total. That's the window that we're in. So he has the power to do things, which, by the way, the legislature is keeping him in check. When he was talking about the stay-at-home order, myself and 3 others wrote him a letter and said, such a drastic move, even if you're empowered to do it, you should come to the legislature, the House and Senate, and explain it to us. Now, why is that important to me? Is I really believe in separation of powers, the executive, the legislative, and the judicial. I know a lot of people can argue how much that's respected these days, but I do respect it. And we've given, in cases of an emergency, a lot of powers to the executive branch, which I understand temporarily. With something this grave, he should certainly come to the legislature because we represent all of you most directly. We're the ones that answer to you, boots on the ground, all that, and we're the ones that legislate. That's our purview. That's what we're supposed to be doing. So even during a peacetime emergency, we did ask that he does that. So I'll rattle through a couple of these executive orders because you're probably familiar with them, but here's what's happened in about the past week, a little more than week and a handful of days. So the first things that they did was they closed the schools, right? And those are going to be closed for a month. It's general. The murmurs and the rumors are it might be longer than a month. Some people say to the end of the school year. That's not official right now. It's just a month. That'll be readdressed, and I'm sure we'll have discussion about that in the future with the schools, with the administration, with the legislature. Also, they basically opened the schools, if you will, to makeshift daycare. Some of them, of course, have daycares, but they've opened that up for medical professionals so that they can make sure that they do that work. And I think that was a good idea. The one that we mentioned earlier, that closed the bars and restaurants, that was a very, very significant move. He expanded unemployment insurance, and I gave you a link on how to find out about that, the SBA loans and some other small business services, and I think those are going to increase, okay? So, but anyway, those are some of the things. He expanded the ability for Department of Human Services to act more quickly, and that's kind of into the weeds. I won't get into that too far. Don't even know all the things they do, but DHS, Human Services, takes care of everything from county health issues to child safety, to all the different things that the DHS does. And as it relates to the COVID-19 virus, DHS has been kind of enabled to do things a little more easily, a little more quickly. Now, that's probably the thing that we need to do, but as some of you know, DHS has not had a good record in the state in the last year. They've had a lot of things come up. So we need to give them that, but we're going to be keeping a close eye on that one. I don't have any concerns like they're going to do this or that, but that's something we're really going to have to watch. After that, there's lots of executive orders. As I said, go to that website. You can see them all. Most of the executive orders kind of fill in underneath these major ones that we said, kind of obvious things that they have to do to equip the different agencies or do different things underneath that. Again, go to newhousegop.com and click on the menu on the left, and then click on COVID-19 resources, and you can get any more details you want. And then if you have any questions, by all means, give me a call or email me. Okay, so let's get into this sticky one. Let's get into the stay-at-home order. It was only about 4 or 5 days ago we called it the lockdown order. And that was probably actually not an accurate description. It was probably true to what we were talking about at that time, but the stay-at-home order. And I have very grave concerns about it. I actually, at this time, don't support it. I think it's premature if we enact it. I know a lot of other states are doing it. I can tell you Ohio, Michigan, Wisconsin, and Illinois have enacted it. So you can see what trend is happening here. Of the states that are contracting or showing lots of cases, like Minnesota, they've already enacted this, and I think they're going to be doing it here pretty soon. I've heard nothing. So the downside to that is what basically a stay-at-home order is. It's not as restrictive as you would think. But that doesn't mean it's any good, but it's not as restrictive as you think. You're not going to have National Guard patrolling your streets like you saw pictures of in Italy, and if you stick your head out, you're in trouble sort of thing. They're asking people to stay at home, and they're requiring non-essential businesses to close. That's going to be very devastating on the economy, not only for employees, but also for employers. But here's where I want to give you some comfort if you're a business owner. That stay-at-home order is for non-essential businesses, but in the states that have approved this in recent days, you look at the list of what's essential businesses, and it's a very broad spectrum. Anything related to agriculture, for example, anything related to trucking, anything related to public safety, anything related to basic infrastructural things like electric, sewer, all those things. So you can see where this is going. I know that they are actually giving my stepdaughter is a veterinary technician, and she was told her business in the veterinary office that she's in is going to stay open if they shut things down, because veterinary services are considered essential services. So you see it could be really broad. Unfortunately, whoever ends up having that hot potato that they are an essential service, that's going to be terrible for. And so that's one reason why I don't support it. What it means to the economy, I'm not an economist. I don't know. I'm very worried about it. I think when there's a bunch of people laid off, I think when businesses aren't doing commerce, nothing good can come out of that. And we'll have to see how we rebound out of that. A lot of people talk about bailouts or things like that. We're just going to have to work through that as time comes, folks. So that's basically, I don't have more unless there's questions on it. I don't have more on the stay-at-home order. I don't know that it's coming for sure. I know that we are kind of in a position to do it. So in my opinion, we're probably going to be hearing from it soon. After the president talked yesterday on his press conference, and then what he's coming out saying, we don't want how does it go? We don't want the cure to be worse than the disease. There's some concerns about if we shut things down. And for people that say, well, the economy isn't as important, I agree with you with that. But with a bad economy comes different types of deaths. And so if we are going to look at it that way, we need to be very, very cautious of what we do, how we do, and why we do it. So anyway, we'll see what happens if the governor comes out with it. Those, the terms, maybe I can even come up before next Monday and we can discuss the terms of that and have a conversation. I'll let you know. I don't know if he's going to do it. I've asked that, as I said, that he brings the legislature into it. I haven't heard anything yet, so either he isn't going to do it yet or he's going to ignore that request. We'll see what happens. So in the final 5 minutes, I want to tell you about something real specific that's going on out here, and it is public now, so I feel comfortable talking about it with all of you. So one of the concerns that we had when we were funding all these different things and saying if there's outbreaks all over the state, what's going to happen with rural Minnesota? Now, what we mean by that is the hospital systems that are in place, we have obvious things like Mayo or University of Minnesota or some of the big systems that are in the suburbs, or St. Cloud, up in Duluth, some of those places. But what about small places like Montevideo or even smaller, as you go out west of there? What are we going to do? Well, there's a group of hospitals in 3 counties, in Swift, Chippewa, and Lac Parle. I represent Swift and Chippewa. Representative Chris Wodzinski represents Lac Parle, and he's been apprised of all this. They have a network where they've worked together. They're independent hospitals, and then they've also brought in Benson Swift County Area Health Services. Sorry, Benson, I just forgot the name of your hospital with the technical term, but Benson basically. They brought them in shortly after, but they had a call-in that talked with the U.S. Department of Health about the condition of hospitals, what they can expect, what they need to do, all the questions answered, that sort of stuff. And what came out of that was these small independent hospitals said, we're gonna pool our resources together and we're gonna address this, that if it blows up out in west central Minnesota, we're gonna be ready for it. And I can tell you what they've done in the past week has been nothing short of amazing. When I say past week, they really kind of got started on Tuesday. They were really going full speed on Thursday. And what they've done is in Appleton, there is the Prairie Correctional Facility. Some people know what we're talking about. And that is going to be taken over by what's called the Tri-County COVID Medical Center, the TCMC. And you're going to hear a lot about the TCMC. So what it's basically going to do is it's going to provide acute medical services, basically hospitalization all the way up to the most serious cases of this COVID disease there. It's going to be isolated. It's going to be held there. It's not going to go into the hospitals, which helps them with their other operations in the hospitals. And it's going to, it's a really, really good solution. So what they've been doing is they have some challenges. Number one, they needed to know if they could even use it. So they went through the proper channels. I helped them with this part. This is not my project, so don't think I'm trying to take any ownership other than I'm so proud of them. You're going to hear me talk about it like it's mine, but that would be the only reason. They're doing a great job. The hospitals and counties are working very hard together on this to make it happen. And so they had to talk to CoreCivic, the owner of the facility. And what's wonderful is CoreCivic not only agreed to let them use it, but CoreCivic has gone above and beyond. They're charging no rent. They're helping them. The facilities, as you might imagine, have to be redesigned to be for patient rooms. Now, for those that don't know what the Prairie Correctional Facility is, a room is not exactly a room, okay? So they're taking the old cots out. They're putting in hospital beds. I'm told they're even painting the rooms a different color to make them look more hospital-like. And they have all the equipment. They've done a mock-up. They know all the equipment that they need to move in there should someone be sick. Now, here's the great thing is that facility was designed to isolate away from the community. That's exactly what it's going to do here, folks. So there's going to be many details coming out, but I can tell you that they're going to start out small. They're going to basically be set up for 12 beds. If they need more, this is scalable. In the pod that they're doing, there's 3 other pods, so they just do 12, 12, 12, 12. They can get it to 48. And the way they have it set up, they can go up higher than that if necessary. Now, that's planning for the worst. That's hoping for the best. I sincerely hope that we don't have to use it. But if we have it, it's going to be there. They are working around the clock out there. As I said, Core Civic is helping with that. Another thing they have to get is licensing through the state. And I can tell you, Senator Michelle Benson, she grew up in Swift County, south of Murdoch, on a farm. She's helped us out a great deal, and she got us connected. We're having a little bit of difficulties with the licensing issue, and she helped us get it with the right people, and the hospital CEOs are working through that at this time. Another issue is there's going to need to be funding for this. Now, I want to be clear about something, because this is one thing that's going to come out. What is that funding going to be used for? If there are no patients, first of all, if there's no patients in this facility, we count that as a win, because we're planning for the worst, hoping for the best, right? So the funding follows the patient. There's a little bit of upstart money that's going to have to be spent to get things arranged out there. We had a big expense that came in today, and even with that, we think it's going to be about $30,000 to get things up and running completely. And that's an incredible amount when you look at some of the costs that are involved with this. The money that we are requesting from the state, see, I said we, that they are requesting from the state is for the operations. They're going to need doctors, nurses, supplies, all that sort of thing. So the operating expenses, that's where the state money will go. That's the way that money from the state was designed. This is not to buy hospital beds. This is not to buy respirators. It's been real great. These 4 hospitals have pooled their resources together, and they have all the beds they need to move out there. They have enough respirators. That's one of the key things. They have oxygen that's going to be set up out there. Core Civic has been great to make the facilities. They put in new air filters for the HVAC system, just all sorts of different things that they need to do that's going to be set. But none of this state money is going to go to that. So it's only used if it's needed. I want people to understand that the money is available, but it's, for those of us who are a little more fiscally conservative, we get nervous when big piles of money get thrown on something because it tends to get spent, right? That's not the case. People are really behaving well. I can tell you that the governor's office, short of me not agreeing with closing hospitals and clinics, much of what he's done has been real good decisions. And I think the state is working together, Republican, Democrat, Senate, House, Governor. We're all on the same page. Department of Health, Department of Human Services, FEMA, Emergency Services of Minnesota, all of them are really working hard and working together. And that's going to show up in the TCMC, the Tri-County COVID Medical Center. So about the only other thing that I want to say about that is that the facility is unique in that it can isolate people out. But one of the concerns we have is we don't know how to say it any other softer way, but just make sure people don't feel like they're going to jail, because that's not the case at all. This is going to be a medical hospital, and they're doing everything they can to basically make the portion of the facility that they're going to be using to look very friendly, very welcoming, at least to the extent that hospitals look friendly and welcoming when you're sick and you don't feel good. But it's going to accommodate all those considerations. One of the great things out there is we have, I need to slow down. Sorry about that, folks. One of the great things out there is there is full kitchen services. No, there's full kitchen capabilities there. There's full laundry. They can operate everything out of there. This is just an ideal situation. And should we need it, I'm very encouraged that we have that out there. I do think that if things were to get real bad, which I don't think they're going to, but if they were to get really bad, we would be able to expand out there. So that's kind of what's going on. As with everything else, stay tuned. I'm going to wrap it up here in just a minute or two. We've gone quite a bit over of what I normally go. But anyone that's still listening, are there any final questions that you might have? And I know that you're on delay with this, so I'll give it a moment to see if I see any comments coming in. So let me know. Okay, as I'm waiting for maybe a couple questions coming in, maybe there aren't, and that's fine. I just want to tell you one of the things that I've really been encouraged by is the way that people have come together and worked for a common good. This is very early in the situation. There's a lot of questions. There's a lot of concerns. There are fears. But people are responding in very positive ways. And I can tell you that if this is long, drawn out, all the different things that are the worst of our fears, I'm positive that people are going to step up and do great things in this. This is a time, this is where the United States of America shines. When things are at their lowest, we tend to rise to the occasion and we do great things together. And I think that that's the lesson that we need to come away from this, that we can join together, that we can accomplish great things. So coming out of this, that we have less acrimony, less hatred towards each other. Let that be one of the good things that come out of this. So thank you for joining me this evening. God bless each and every one of you. Again, please pray for those that are sick and those that are in the front lines, the medical professionals, the truck drivers, the many different people who are doing the little things, the daycare providers, the many different people who are helping us get through this. Take care, stay safe, and we'll see you next time.